Thank you, Madam Speaker. Talked about this a whole lot the other day. We tried to pass what I thought were good amendments, and they were not accepted. Seems to be the way to do things on Fridays. You know, I have some real problems with this bill. I think that we keep hearing that this is about access. I don't know that the people of Colorado are actually believing that anymore. I don't. Colleges must provide abortion medication services on site. Campuses with pharmacies must stock abortion pills. Schools without pharmacies must still facilitate access or dispensing. Applies to public and private institutions with limited religious exemptions. I believe this mandates abortion infrastructure, not just access. I think there's access everywhere. I think that there's local pharmacies everywhere you look. I believe this is a cost shift hidden from taxpayers. Schools face training, staffing, IT, and liability costs. These costs are then going to be pushed to the students' fees and tuition. We have a ton of students, undergraduate that are part-time, about 140,000 students, graduate part-time about 27,000, which means nearly 1 out of every 2 college students in Colorado are part-time. We say it's free, but it's not. It's just hidden in your kid's tuition bill. We said that the abortion pill costs about $800 per use, and there's about thousands of kids this age taking them. It requires new clinical protocols, training, and follow-up care. College clinics are not ERs or OBGYN facilities, and we talked about that. We talked about the complications of taking these pills, and then we tried to discredit the article about the abortion pill that harms women. And I just want to tell you about the 2 people that wrote this article and did the research. One is a research fellow in quantitative analysis who worked for the CIA and NSA, and he was a graduate of Harvard. The other one has a Bachelor of Arts from Princeton, where he graduated Phi Beta Kappa and magna cum laude. I also did, just for the note, just for anyone that's wondering. Master of Arts from Notre Dame and a PhD in political philosophy. And the gold standard that I talk about is a random control trial. We can't do that here because a woman that wants to get an abortion, you can't just give her a placebo and not give her the abortion pill. So instead, they took almost 900,000 women's charts and reviewed their charts. And let's talk about, because they also said this wasn't a peer-reviewed study. So let's talk about why it wasn't. The point is not peer review, but replicability. So they have made this fully replicable. We have made our study fully replicable for anyone who wants to analyze the insurance claims data. So they just took this straight from the patient's records and the ICD-10, which is the code that you get for a diagnosis, to analyze the insurance claims data. The replicability crisis, well documented in the press and denied by no responsible person, is the evidence that peer review guarantees little. We stand behind our analysis of healthcare claims data, which is why we're asking the FDA to conduct its own review of this data. Real-world data in which money changed hands based on the treatment of patients and coding by doctors brings a high level of confidence. The data set is available for purchase and our methodology is public. The study is fully replicable and we encourage others to replicate it. The peer review process is broken. It's terribly biased against conservatives, especially social conservatives, particularly pro-lifers. The paper would have been leaked so as to prepare hostile responses if we were ever published to begin with. So they have taken this study of 900 patient records. There's no way to falsify it. These are women that took the abortion pill, and then they took their records and the insurance claims, and they put this into a study. Peer-reviewed journals such as JAMA, the New England Journal of Medicine and Health Affairs regularly publish studies based on administrative claims. It is especially vital for medications like mifepristone, where controlled trials have small samples, carefully recruited healthy patients, physician oversight, and limited follow-up. Post-marketing surveillance is passive and incomplete. Reporting requirements were loosened in 2016. So what did they find in this fully replicable study that anyone could do? And the reason they haven't done it is because they would find the same exact things. We're not arguing abortion in the state of Colorado. None of us came up here to argue it. We said there should be follow-up care for these women that are just going to go into a random healthcare center at their college, given a pill with no informed consent. One of the representatives from Denver said there should be informed consent, there should be education. There's none of that. They don't understand the major complications that 1 in 10 women will experience sepsis. Sepsis is when your body is dying. Infection, in which you need an antibiotic. Hemorrhage is when you're bleeding out, and I can't talk specifically about it because people get offended apparently, or another serious or life-threatening adverse event within 45 days following a mifepristone abortion. That is 1 in 10 women. Why are we not protecting these women? We're all about access. Why aren't we about public safety for these women? We're just asking for public safety for these women. We're asking for follow-up care. We're asking for boys not to be able to get this pill to roofie their girlfriends, which has been proven in 2 different states, Massachusetts and Texas. We wanted amendments to give these women safety. We're showing you a study that had 900,000 women that says 1 in 10 patients will experience not a small side effect, not like taking an Advil, not like taking a Tylenol, something with a serious adverse effect. Again, not contemplating the idea of abortion in Colorado. We're talking about follow-up care. We're talking about making sure these women are protected. This bill is not about access. It is about a mandate. It forces colleges to provide abortion drugs, shift costs onto students, and expands medical services without ensuring medical safety. This is not about choice. We should be strengthening healthcare, not politicizing campuses and burdening institutions. And if I was in charge of a private institution or a public institution in the state of Colorado, close your healthcare centers. Force these students to find a doctor somewhere else because we're mandating unsafe practices onto you. You will be sued, you will pay the consequences, and I just wouldn't do it. I would tell the General Assembly, we're not gonna do it anymore. Close your clinics and say no more to the chaos happening in the Golden Dome. Vote no on this bill.